Good morning. Welcome to this meeting of the Health and Welfare Committee. Today is April 21st, 2022. It is now 9:08 a.m. And I call this meeting to order. My name is Christina Sablan. I'm the chair of this committee. Present in the chamber today, we have our vice chair, Representative Leila Staffler, and member and vice speaker, Representative BJ Attel. And with that, we now have a quorum. I'd also like to recognize the presence of our staff, legal counsel Joe Tyron, legislative assistant Claire Sablan, Miss Malia Johnson, our legislative aide is taking notes or minutes for today. And then we have our IT staff, Del Camacho, who is live streaming and broadcasting this public meeting. With that, colleagues, may I request a motion to adopt today's agenda? Motion has been made and seconded. All in favor of adopting today's agenda, please say aye. All opposed, please say nay. Motion carries. Today's agenda is now adopted. Next in our order of business is the adoption of the meeting minutes for February 14, 2022. May I have a motion to adopt those meeting minutes with leave colleagues, if there are no objections, to make minor technical corrections as needed before we file these with the House Clerk? Motion has been made and seconded. All in favor of adopting the meeting minutes of February 14, 2022, please say aye. All opposed, please say nay. The motion carries. Meeting minutes are now adopted. Next, we have public comments, and I'd like to open the floor now for anyone in the gallery who wishes to make comments on any item on this agenda. If you could please state your name for the record and any organization that you may be representing.
Good morning, Madam Chair, Madam Vice Chair, and the Health and Welfare Committee, to everybody watching at home. I wanted to start by thanking everybody first and foremost. Everybody's been so supportive during this whole journey with fighting for equality for the transgender and LGBT people. My name is Tyra Sablan. I'm a 42-year-old transgender daughter of the Marianas, and I'm here to try and convince the people that may have some reservations on these two bills. The first bill is the Vital Statistic Act amendment, which requires surgery for transgender people to undergo surgery in order to be able to change their gender marker. During the petition that we had around, I had a lot of questions asking me why we need such bill. And the reason why we need this bill is because not all transgender people want to undergo surgery. And I think that we should leave it up to trans people to be able to define who they are without having the requirement or having another person tell them that you need to do this or you need to do that. And it's also a huge barrier because a lot of trans people cannot afford surgery. And so what do? I mean, do we just tell them, oh, well, you just have to go through the surgery in order for you to be able to live your life as who you are? Yeah, so, and the other bill, which is the Equality Act, is a bill that specifically adds gender identity and sexual orientation as sex discrimination. And the reason why we need this is not because we want to put blame on people or say that that there are bad people out there, trying to harm the LGBT people. While that is true to some degree, this is more of a addressing institutional and systemic discrimination that we have from laws that were placed post-colonial times. And a lot of these laws reflect ideals that don't match our culture. We are from the CNMI. We are Pacific Islanders. We're, we're a mixture of a lot of Pacific Island races here, and our culture is a culture of respect and love. And a lot of these laws, like let's say, for example, the law that was passed in 1978, 1979, banning same sex marriage, those ideas came from colonial times. These are not our ideas. Nowhere in, if you did research on our cultural background, nowhere do you see anywhere in our history saying that we hated on people who are different from us, gender variants. Never did we have any kind of racism. I mean, even during the times of the Carolinian migration and the Chamorro mixture here in the Sinamai, we've never seen such racism, and I think that this bill, if passed, will help a lot of people. It will help people get healthcare, the type of healthcare that they need. It will help mold ideas, and it will help shape some of the thoughts of people, because laws, as much as we don't like to admit it, laws shape the minds of people. And I think that this law, if passed, will set precedents in a good way. So I urge you guys, if you have any reservations on voting yes for this bill or passing this bill, I urge you guys to please take in consideration your family members who are LGBT. A lot of you guys have cousins, aunties, uncles, maybe who are alive, maybe who passed away. Unfortunately, they're not going to be here to see that, we're finally moving forward. And if we do pass this bill, that, we're going to make history, guys. We're going to be on the world stage. We're going to be the first advocates in the Pacific Island to advocate for equality, and look at what happened with the marriage equality bill, right? It brought us a lot of money, a lot of tourism. Equality is good for business. And yeah, I just wanted to thank everybody. Thank you.
Thank you so much, Ms. Sablon. Before you go, I think I do have a couple of questions for you. And before I go into that, I just wanted to recognize Representative Donald Manglonia, who is now here in the chamber. Welcome. My first question is if you had a chance to review CHCC's comments on the vital statistics bill, specifically recommending the need to clearly define persons who may request for a change of gender designation. Let's start with that.
Yes. So I was able to quickly review it, and it's fine.
Mhm.
And I do believe that there should be a clarification on that, on who would be requesting for the change.
Okay, and then there was a further recommendation for the registrar to furnish an application for change of gender designation on a birth certificate, um, and that there be an attestation under penalty of perjury by the person submitting an application that it's that the purpose is not for any fraudulent reason, but to conform the person's legal gender to their gender identity. Do you have any comment on that?
I'm all for it. I think to preserve the integrity of the process, that would be an awesome requirement to have.
And then I think the third and final recommendation was to include provisions that would restrict another request to change gender designation once prior approval has been given.
With that, I see where the thought came from on that, but there's been through research, it's been proven that gender identity is very fluid, and although, how do we say this? Yeah, so gender identity is very fluid, and I think that we should leave it up to the person identifying um, whether or not they want to change back to another gender. Then the cases of people transitioning and then detransitioning is very small, but I've known maybe 2 people in my life who's done that. Um, so I think, in my opinion, I think that we should just leave it up to the person, not without any requirements, to come up with their gender identity. And if they want to change back, I think that's their right to do that. And I don't think we should limit people, or require people to just say, okay, if that's what you want to be, then that's what you're going to be. It's
Okay.
like we're allowed. I think as people, we're allowed to grow into an identity and grow out of that identity. I think that should be a God-given right, and I don't think we as human beings should limit people.
Thank you. And I just wanted to also express my appreciation to you for being such a tremendous advocate and for connecting us, the members of this committee, myself in particular, with the legal resources that you've had access to help us just understand the lay of the land and where the CNMI sits currently in terms of our LGBTQ policies. Um, and and I think the final question I wanted to ask you at this time is the one CHCC flags another issue to bring to our attention, and that was whether passport and social security offices would accept amended birth certificates.
Yes,
And
absolutely.
okay,
So current law, for the State Department and also for Social Security, does not require any kind of surgical interventions, any doctor certificate, nothing. It's a self-select, and I think we should follow that route. If it's good enough for the State Department, why not for our local laws? I think that since we do serve the people, this is a way of serving them, being able to trust them to make the decision for themselves, about their gender markers.
thank you.
Yeah.
Colleagues, do you have any questions, any other questions for Ms. Sablan? Did you say that you had petitions and other testimonies to submit today?
Yes, I do. And I also
Okay.
have some electronically that I sent. So, but here's the hard copy.
Okay, thank you. If you could just submit that to Nalia, who's behind you, and we'll accept it for the record.
Okay, thank you.
Thank you so much, Ms. Sablan. The floor is now open for anyone else who wishes to make public comments.
Half a day, Chair and Vice Chair and members of the committee. My name is Esther Munya. I'm the CEO for the Commonwealth Healthcare Corporation. I just want to say I support the new version of House Bill 2277 for the Medical Referral Act. And since we've been taking over the operations of medical referral, we have been really unpacking and looking at what are the gaps of services, and we want to be able to maximize funding from whether the other payers, for example, Medicaid or an insurance. We want to be able to maximize that and ensure that we kind of reduce the cost. And so we're working on a lot of things right now, a lot of changes, and I believe we're on the right track. And this bill will really definitely put us there. Thank you.
Thank you and welcome, CEO. I wanted to ask you at this point if you could just give us a brief summary, an update since our last meeting on where CHCC is at in terms of the transition to medical referral. And one of the changes in the substitute bill is that we would make the full transition period 120 days. I think the original might have been a little bit longer, but yeah, just to get some insight from you as to where we are with the transition.
What we have done so far is we've made the changes with personnel. For example, when I say changes, I mean basically they are employees of CHCC. We've given them orientation. Some of the benefits, they don't, like, for example, they're not members of the retirement, which was interesting. So we discover a lot of these things that are kind of missing. We've also we're working on the regulation change, and we are working on the expansion of going to the foreign hospitals, working with the governor's office to allow Medicaid to pay for that. And so it is in the actually I submitted it to the governor's office already, asking them if they could make a state plan amendment for Medicaid to include foreign hospitals, and looking at Korea, Japan, and of course Philippines and Taiwan, and other areas in the Western, in the Asian region. We're also trying to address the policies and procedures. There's a lot of policies but no procedures, so we want to be able to address that, ensuring accountability for you know if someone is, for example, when there's a patient that's been transferred to the states, who monitors that. Those are things that we're looking at. We're looking at the gaps, um, giving the clinical staff. So putting it under the hospital is really essential, because we want to make sure that when the patients are sent, that there's report back, and that we transition them back, and not just okay, you're done with the care, you come back, the services may not even be available here. Let's say there's continuity of care. We want to make sure that those are addressed. So I got to tell you, there's a lot of gaps. So we're still fixing them, and yeah, it's really tiring.
I can imagine. So at this point in the transition, though, all of the records, the bank accounts have been established. The
Yes.
staff have all fully transitioned, or they are still transitioning.
Yes,
Yeah,
and
in
we're
terms of
looking at the rooms
classification.
too.
Okay, and are you restructuring the whole program now? I understand you have a new director.
Yes,
Right.
so we're putting it under the hospital.
Okay.
So the hospital, the chief operating officer is responsible for that, and there is a director that kind of just looks at the Saipan office, Honolulu office, and the Guam office.
Okay.
We're looking also at the rooms. There is a lot of blocked rooms, and so we're going to take a look at that and look at the utilization. Making sure that that a patient who's staying in the room actually has a medical treatment authorization, so that again, ensuring that utilization is there, and not second guessing someone just because the block room is available. I mean, I'd rather pay for an empty room than a room that's occupied by somebody who doesn't belong there.
Sure. And I guess my last question for you, CEO, and then we can see if the other members have questions, is if you could shed a little more light, for the record, on CHCC's proposal to do away with the references to medical referral, and to establish instead this more integrated health network program within CHCC. It's because it's not just changing the name, right? We're not just rebranding the same thing. Could
Yeah.
you just explain what the differences would be?
So the difference would be to have a relationship with the providers that we're having, we're sending patients. So it's not just, receiving. We want to be able to bring providers here also, and be able to provide services here. So it would be like a partnership. So when we sign agreements, we will have agreements with partners. Hospitals will also have agreements with Medicaid, because that is a requirement for Medicaid to pay anyway. But the relationship will expand to provide services. I mean, it's basically a two-way relationship, and rather than just sending patients off island. We want to be able. We know, especially with the COVID, what we saw was that people don't necessarily want to go off island. There's people that do, but there's a lot of people that don't and can't afford it, whether it's time off from work. Especially their caretakers are also taking time off from work, so it does affect them financially. Really, it's hard to watch it and not realize that it's really impacting their household as well.
Thank you. Colleagues, do you have any other questions for the CEO? Vice Chair Statler.
Thank you, Chairwoman. And thank you for being able to be available for us this morning, CEO Munya. I was very interested in the transition part of this bill in particular, having dealt with the transition with NMTI and a lot of the struggles that happened, and having that timeline of 160 days as it is written, it can you comment on how you feel, if that is enough time, or with the transition parts in general, do you feel like there's enough structure that it would be smooth?
I believe the time is, we've been taking over basically. We did not slow down at all. We knew that we were going to be responsible anyway. So the board approved for the new accounts to be set up. We are giving debit cards. That's already in place so that there's no delay in their subsistence. We are working on a credit card a separate credit card for referral, and that's going back to the rooms. Do we really need that many block rooms, or can we reduce the number of block rooms? And if there is a need beyond our block rooms, then we can just basically charge the credit card and guarantee that, and so that so again, reduce the expenses. The transition's been going smoothly. It's just every time, almost every day of every week, there's something that we find. And again, going back to the auditor's opinion or finding for policies and procedures, there is that missing part. Who's responsible for ensuring the policies are in place, who's making sure that there's really the outcome of what the policy is supposed to, the intent of the policy. Are we making sure that that is really happening? So the transition really is happening. It's been we actually took over in October. However, around January, it's like we got to do this. We can't continue to wait. So it's moving along. I wouldn't say smooth, but it's moving along.
Thank you, CEO Munya. I totally get that there will be lots of when you're recalibrating systems like what you're doing, and God bless all of the staff that are taking this on. It really will make a difference in the overall structure and availability to access. So thank you.
Thank you. All right.
Thank you, Vice Chair. Colleagues, did you have any? Representative Maglonia.
Thank you, Chair, and thank you, CEO. I just wanted to find out more about because I've been hearing a lot of concerns regarding, I guess now, the eligibility criteria has kind of been enforced since CHCC has taken over. Do you offer any assistance, or do you have any consideration in regards to those who don't meet for example, the income bracket, but also can't afford to go on their own?
So the eligibility criteria has not changed. The only thing that we found was that there was a lot of kind of sort of like a discrepancy. I discussed this with our board and then our legal counsel. There's a certain criteria for income criteria in different types of benefits, which to us doesn't make sense. If you are qualified, why were you not qualified for other benefits? We saw, for example, there's an eligibility for transportation, airline transportation. It requires that you have to make less than $25,000, which is probably a lot of people. So, and then it requires that we purchase a ticket at 100% for the escort, but the patient has to pay 50%. So we changed that and basically say that if you're qualified, you're qualified. And, kind of makes me wonder why people do fundraising a lot, So we kind of got rid of that. And that will be also, again, it's so we're doing some kind of just, immediate changes. the eligibility, again, it's actually, so it really does, in fact, open more for more eligibility instead of less. There may be some confusion, I think, because the question, the auditor mentioned that there's some criterias where the director will make a decision over a committee, the fact that the committee said no or said yes, and then or for whatever reason, it basically, the director comes in and changes that. There is no criteria to decide that. And so, what basis does the director make that decision? That was in the audit. And so our purpose, or what we decided to do, was to look at, to stick to the regulations on the specific, I guess, diseases or needs that they have to meet. And in regards to income, that's, again, it's it has to be strict, of course. But people have been getting benefits, other benefits of maintenance, and it doesn't have to be so much of an income. So, and it's really dependent on what their needs are. So we're trying to come up with the criteria of how do you override the decision of the board or the committee. That's really all what we do.
Thank you. And just one more. So I'm sure you're aware of how the delegation has assisted, at least inter-island travel, inter-island referral in regards to stipend to assist with um, their meals. But is that going to also be taken upon CHCC to assist the patients now that it has become a uniformed referral policy? Or
So the referral for subsistence is only for leaving the CNMI. So we could include it, but again, I think that shouldn't be a big problem to include it. The question there is, do we have adequate funding? And we could definitely can, because it is, if it's budgeted, we would definitely ensure that it's there. Once it's budgeted and once you approve, we issue the checks, as you noticed.
well, I just wanted to figure out why it wouldn't be considered, seeing as how it, despite it being within the CNMI, they're still having to travel elsewhere for medical attention.
Yeah.
And so,
So we can include that in the regulations. That's something that we can take a look at.
Right.
Obviously right now it's not there, and we're just, we want to make sure, and since you're funding it anyway, so.
Yeah, and that was my hope, because
Yeah.
in the delegation, it's based upon availability of funds, and so when we do have the money to pay for a certain period, those that weren't in that period, end up not getting anything. So we want a more consistent and
I think that's we are the new process is definitely including, I mean, I think having it inclusive to all overall operations is important, and that is something that we're going to be ensuring in the new regulations, is that whatever, when a person needs transfer wherever, whether to come to Saipan, I mean, be able to say that this is part of our system anyway. And that was the purpose of saying that it's basically a network. And then when we send patients out of the CNMI, it's that the part, all those part of the network is included. I failed to mention that the other thing that we're expanding to is, rather than sending people to off island, doesn't have to be the locations that we have block rooms. So we would be able to send people wherever, anywhere in the U.S., and we don't necessarily have to just say Los Angeles or Honolulu, especially for people who have family members in different states.
thank you, Sue.
Thank you,
Chair.
Representative Glenier.
I,
Representative Atto.
Thank you, Madam Chair. Good morning, CEO. You mentioned that the hospital is planning to get a credit card. Is this credit card one that's a corporate card that can gain miles, possibly?
We already have a corporate credit card, so we're going to add. Basically, we're asking for an increase in the limit, and then another card would be issued
Okay.
with the same account basically, but it will be having a different number, and it'll be, so we can separate the
Sure,
the
sure.
charges. So it will be separate from operations of CHC, other operations of CHEC.
So the credit card that you currently have the benefit of receiving miles for the
No,
usage?
no, not at this time. We were looking into it, but that will require for us to just open another bank account from another bank institution, and
Mm.
so it's possible, but at the same time, we're also looking at actually enrolling in United. There's a there's a business part there. I think it's almost like we become a travel agent ourselves.
Yeah.
The CFO knows the name of. I'm sorry, I don't have it on the top of my head, but it requires for us to enroll in that, and if we enroll in that, that will be it's basically like depositing 100,000, and we just continue to draw it down,
Draw down.
so we get the best deal for the tickets.
Okay, so that would kind of take away the whole going to the travel agency, for example. So we just pay straight to
Yeah.
to CHEC. Okay, that's
Um,
actually perfect.
Yeah, I know. Yeah, there's of course, there will be always time when we would need to go to the travel agent,
Sure,
especially if
sure.
it's, yeah.
Yeah, 'cause I think that's one of the difficult things when you go out of a medical referral, they'll call you like the day before the last day of the payment. You're freaking out because you have to pay by 3 o'clock today, and
Mhm.
you have to scrap for the money.
Yeah, we've been using Star Marianas with the credit card, so it's
Okay.
nothing new that we use.
All right, thank you, Madam Chair.
Thank you, Representative Attal. And just to clarify the question raised by Representative Maglonia, so CHCC is right now coordinating inter-island care for CNMI
Right,
residents.
but without stipend. The current policy does not include the subsistence,
Okay.
and so it's only on availability of funds. So the medical referral current regulations covers
Mhm.
only off island. So what we will be doing, and we're
Mhm.
working on it probably before the summer.
Mhm.
We should be able to have a regulation proposed that will incorporate everything from basically from Tinian. I mean, we're kind of like incorporating it now to the point where if someone is sent for referral from Tinian,
Mhm.
that that the person doesn't have to go to Saipan and get processed again. It's basically that person is already a referral.
Right.
Yeah.
But this health network program that would be established in this legislation, if it's passed, would encompass, the network would encompass both care services within the CNMI and also outside of the Commonwealth.
That's
Right.
the intent. Yeah.
All right. Thank you. Any other questions for CEO Munia? While you're here, I wanted to thank you for submitting comments on the other bills that are on our agenda. And I see that you have other
Yes.
members of your team who are here. Did you want to also speak to House Bill 2280 or House Bill 2286?
I guess I would like to ask the members here.
Okay.
Our staff. Thank you.
Thank you, CEO. Good morning.
Good morning, honored members of the House.
Oh, please turn on your mic. There you go. And state your name for the record.
Yeah, my name is Wilbert Rossbill. I'm the state vital statistics registrar. I oversee the office, the enforcement of the Vital Statistics Act. I am actually here to provide testimony on and support for House Bill 2286. I'm fortunate to review the bill, the draft, and I should take note that some members of the state's majority of them actually supports the requirements, not the requirements, but rather the individual requesting for an amendment of a gender on a birth certificate without the need to undergo surgical procedure, including the court order. So the existing statute that we have here actually authorizes for the gender change. And again, it's well worded in the current bill is that or the current law is that one has to undergo these surgical procedures, and the intent of this bill is to remove those requirements. So, yeah, with some of the comments that you mentioned, or some of the concerns that we have, that I hope that the members would consider. And I am actually here to answer any questions you may have.
Thank you so much, Mr. Rossbell. I appreciate the recommendations that you made for making some amendments to the legislation. I don't have any objection to including the definition of who would be eligible to apply for these gender marker changes. I think I did want to ask. Actually, I wanted to note your question as to whether the passport and social security offices would accept these amended birth certificates. So Ms. Sablan addressed that. It's my understanding that the Social Security Office actually just very recently amended their own policy to allow for self-selection of gender markers for these Social Security cards. And I guess I just wanted to ask you if you had anything more to add to that, any updated information since then.
No, at that time when I was actually, providing some inputs to the draft, more of an unsure. I was unsure of how that might impact when one has to request for a social security number. We know that when requesting for social security, you need to submit a birth certificate and whatnot, and those that have been issued. I don't know how that might impact when one has to request for benefits or whatnot, and they're able to go through the electronic verification of the event and find out that there's no match there. So my concern is that,
Okay.
nothing more.
Okay. Well, thank you for that. And I guess the last question was if you could address the rationale for your recommendation to restrict changing back a gender designation once approval has been granted.
Thank you. After providing those comments, and I realized that in the language of the bill, the draft, was that once a record is amended, that the record ultimately will become a log file, and only court order would allow authorize the vital records to open up the record. So ultimately, once a record is logged, any other amendment request will not be authorized unless a court issued a I'm making assumptions here because it says log file. And then to address also the integrity of the records and how the process goes through the vital records, the time and efforts and the resources to amend a record. My concern really squarely on the integrity of the process, where we we amended a birth certificate gender change and then lock the record. I don't know how we can open up that record again to do an amendment to change the gender again. So I think carefully we need to consider, in the integrity of the vital record itself. My concern is really that it's not easy to amend a birth certificate because of but we understand that the right of an individual for a gender identity, we understand that. But to submit a request later on, I think it would become a more of a, so what is the purpose of the first request? And what is the intent of the change of mind again after the fact?
Well,
Then
it
you
sounds
go-
like these types of requests would be extremely rare in any event, right?
Yeah.
Okay. And so on the whole, CHCC's position is in support of making this change or making the amendment to the Vital Statistics Act with the changes that you recommended.
Yeah.
Okay. Colleagues, do you have any other questions for Mr. Rossbell? Thank you very much,
All
sir.
right, thanks.
Any other comments from the public?
Good morning.
Good
Good morning,
morning.
Madam Chair, Vice Chair, members. Good morning.
Good
Good morning,
morning.
Madam Chair, Vice Chair, members of the Health and Committee. I'm here in support, and you have received our written comment in support of the House Bill 2280, which is the for the CNMI to be part of the Psychology Interjurisdictional Compact, or the SIPAC. And for a variety of reasons that was stated in our comments, that, you know, the COVID-19, for example, the COVID-19 pandemic has really highlighted massive impact to our residents, our children, the community we live in, that is now starting to show up more and more in the clinics. We are constantly, and they come to us from different perspective, either through the courts with domestic violence increase, or substance abuse disorders that being seen, or children needing to have see counselors at the systems of care. For example, being part of this interjurisdictional process will allow us, one, access to other healthcare providers that we don't normally have, more specialized care. In times of disaster, we can bring in people that are part of these compact states of interjurisdictional to assist us, and we'll work with the licensing board so that the processing on allowing them to see clients is much shorter and easily accessible to the community. The other thing that even though we look at the benefits of it, also it allows us to ensure that whoever does come in here we will have an ability to look at the background, that they are indeed quote unquote altogether to be able to practice in our Commonwealth. A lot of providers, and unfortunately a lot of providers that are in the mental health business do have a lot of really tainted background, and sometimes we are not aware of that because they're either committed it at 5 or 6 different states away or different countries. Having a process like this will allow us to have a better grasp on whether this provider are able to or have had episodes that were questions in other jurisdictions. So things like that will allow us. So I hope that House Bill 2280 does become into effect law, because it will assist the Community Guidance Center, and in particular the Commonwealth Healthcare Corporation.
Thank you so much. And just for the record, would you please state your name and your position at CHC?
My name is Joseph Kevin Villagomez. I am the director for the Community Guidance Center.
Thank you so much. And I had just a question at this point. This has come up before in previous committee meetings, and that is just the backlog that providers are experiencing, and that patients are experiencing, right? Having to wait for months and sometimes over a year to see a mental health provider. What does that look like at CGC?
Well, part of it obviously was because of our inability to have face-to-face, and there's always a limitation on for example, we cannot run groups, right? But that is changing now that we're opening up more. We're back into running groups. Each one of our clinicians are running 2 or 3 different groups. I have a group to run this afternoon. So it's a constant thing because the list has been a while. But we do have a system in place where we do pretty much looking at it, and we triage those that are immediately, for example, suicide ideations or suicide attempts come to the top of the list that cannot wait. Okay, young children that are having difficulties at school or in the home front, or are abusing drugs at a very young age, those are prioritized immediately. And then we have the run-of-the-mill court-referred cases that we're averaging 10 to 15 per week. So if you add all of those up, the number is quite a bit. A lot of the folks would rather just talk to us over the phone. They don't want to come in, and that's why. If anything, one thing that during the pandemic is we did a lot of virtual The only problem we have in virtual is obviously if you decompensate virtually, how do you access those clients right away? So we have to be very careful that you don't switch immediately to virtual and you do an assessment of their ability to be able to do their counseling through a virtual process, or they need to come in and be seen. But we do have several grants that we have received that will increase our number of providers. I know that one of your staff attended the 988 kickoff for the crisis counseling program. I mean, not the crisis counseling, but the crisis team that will go out and address anybody that's in crisis in the community that may be having behavioral health issues. Now that grant is allowing us to hire 5 clinicians, for example. So I just signed off on all the papers, and we're going to be doing the announcement because 988 nationwide kicks off on July 16. We are a day before the US mainland, so we'll kick off before they do. But at that time, it means that anybody in crisis, we would have a team in place that both will answer the phone 24/7 or have a team that will go out to the community to address them. And this is for all 3 islands, Roatanian and Saipan. We're training people from all 3 islands to be part of that process. But this allows us for the means to be able to hire more people through this grant that will fund us for the next 5 years, for example.
That's excellent. Thank you for that very hopeful update.
Yes.
Colleagues, do we have any other questions for Mr. Villagomez? Thank you very much, sir. You
Thank
have
you,
a
ma'am.
great day. Any other comments from members of the public? Okay, seeing none, public comment portion of this meeting is now closed. Colleagues, would you like to take a 5-minute break at this point?
I could go to the bathroom.
Okay, we'll go into a 5-minute recess. Thank you. And we are back from recess. So we are now in the markup portion of our agenda, colleagues. And at this time, I would like to ask that we take action today on House Bill 2277 to review and accept the substitute that has been drafted based on additional comments we received recently from CHC, and that we also act on House Bill 2280, the Psychology Interjurisdictional Compact Bill, and then table for now. I'd like to call another meeting next week, but House Bill 2286 and House Bill 2287 wanted to give us some time to review and incorporate amendments to the vital statistics bill, and then to review the comments that we just received today from Ms. Tyra Sablon. So if there are no objections,
No objection.
can we move first to House Bill 2280? So I wanted to just note for the record that we did request comments from numerous agencies, actually, and we received comments entirely in support of the passage of this bill from providers in private practice, including Drs. Ann Earhart, who is here today. Thank you for being here. Dr. Adrienne Brenn, Dr. Janet McCullough, Dr. Amanda Hughes from the public school system, as well as from the Commonwealth Healthcare Corporation and the Healthcare Professions Licensing Board. And so I wanted to ask at this point, colleagues, if there are no objections, may I have a motion to approve the passage of this bill and the drafting of the committee report to recommend passage to the full House?
Second.
The motion has been made and seconded. All in favor of the motion to approve House Bill 2280 for passage and to approve the committee report as well, please say aye. All opposed, please say nay. The motion carries. House Bill 2280 is now approved for recommendation to pass in the full House. And Ms. Claire Sablon, if you could also provide us with the copy of the report on this bill, including all the comments that we've received. Thank you, colleagues. And next in our order of business is the substitute for House Bill 2277. You all should have received the comments that we received from CHCC requesting additional amendments, and then the substitute bill that was sent to you in draft form that sought to incorporate as much as possible those comments. So just to review the history of this bill, last summer we conducted several public hearings on Cypantinian and Rhoda on the medical referral program. There were several public committee meetings, and we received extensive comments, also reports on the medical referral program. And then the original version of this bill, actually the current version, was actually drafted by CHCC with input from the Attorney General's office. And then subsequent to all these meetings, CHCC requested additional changes. And so I just wanted to review and highlight for you some of the changes that have been made in this House substitute version. Do you have copies in front of you, colleagues? Or, okay. Should we put it on the screen? Can we put it on the screen?
Yeah, we can. You have it on your computer?
I do. Well, I do.
Thanks, Joe.
You have a dongle thing?
No, I don't.
You have a drive? Can you? Is there what is a jack
I
for?
mean, it's okay. I could just summarize it. If everybody has copies. Okay.
I have copies of it.
Okay.
A jack for first computer.
Yeah, do you have a jack?
I don't have a jack.
I don't have one for that computer.
Okay.
Yeah. It's okay. We can review the major changes that have been made. And as long as the members and the staff have a copy in front of them, we can proceed.
We're going off the one from 6 days ago?
Yes.
Okay.
Okay. So the main changes. And sorry, do you have a highlighted version?
Yeah, I was gonna say the one with all the highlights.
Just
Okay.
roughly, we can-
Sure.
Yeah,
Okay, I'm just going to continue, Council.
Sure.
Okay. So colleagues, the main changes, starting from the top, CHCC asked that we establish instead of a travel assistance program, which is what the original bill provided, that we establish a health network program. And so starting from the title, which Ms. Claire, if you could just correct the typographical error, to establish a health network program under the Commonwealth Healthcare Corporation. And then wherever qualified travel assistance program appeared in the original legislation, we have replaced that with the health network program instead. And then also to provide for the orderly transition of medical referral services, administration, and operations to the Commonwealth Healthcare Corporation. Next, we made some amendments to the findings and purpose to reflect the comments that we had received from, particularly from staff in the medical referral office, and also to reflect the updated definition and of the health network program, and to reflect CHCC's description of that program. So moving on from the findings, the next change appears on page 4, where we define the health network program, and this again is the definition that CHCC provided. So this would be an integrated service of the Commonwealth Healthcare Corporation, and as the CEO mentioned in her testimony today, this is a service that is now part of the hospital, and its purpose is to connect patients to CHCC's network of providers and provide assistance to eligible patients with demonstrated needs in accessing healthcare services outside the CNMI that are beyond the capacity or the availability of CHCC. The next change after that is to include health network program in CHCC's description of duties and responsibilities, section 2823. And to officially establish the health network program in section 2837, that's on page 5. CHCC also recommended that there be a reporting requirement on this program, and so that is included now on page 5 in subsection C, to annually submit to the governor and the legislature an analysis of program data, including but not limited to expenditures and reasons for off-island services, and any recommendations for future funding, program improvements, or policy reform. And then the next change is on page 6, that CHCC would have the responsibility to ensure the inclusion of the health network program in the annual budget of CHCC, and to operate the health network program in a manner that does not exceed the CNMI general fund appropriation. We did remove the language that would terminate services in the event of CHCC exhausting their general fund appropriation, and that was also at CHCC's request. So there is still, though, they would still have the responsibility to submit a request for supplemental appropriations. And of course, as the CEO noted today, they are already on track to streamline costs and improve the way they are leveraging Medicaid and other resources to provide these services. And then the next change would be on page 6. Subsection H, so we just inserted CHCC promulgating rules and regulations and other policies pertaining to their network of providers or to the medical referral services that preceded this act. And then the next section is really just pertaining to the transition of off-island medical referral services. That transition is already underway. We inserted a 120-day transition period to finalize that transition. And then the final change is on page 8, colleagues, and this was addressing the outstanding issue of promissory notes that were previously executed by the Off-Island Medical Referral Program with patients. And the Attorney General has deemed those promissory notes legally invalid, and CHCC has said that they don't that this is a receivable, but they don't want responsibility for it. They believe that if they're legally invalid, they should be written off. But in any event, this language would make those promissory notes the responsibility of the CNMI government and not CHCC. I did ask the question that you asked at our last meeting, Vice Speaker, about whether there was any possibility of collecting on these promissory notes from Medicaid. And the answer that we got from CHCC was no. So, and so that is the summary of the amendments that are proposed in this substitute legislation. And we can now open for discussion. Yes, Representative Etta.
Thank you, Madam Chair. Under page 5, I believe that's C, the annually submit to the governor and legislature an analysis. I think we need to put an actual month or date on that, just because the next change on page 6 that talks about the supplemental appropriation. We all know, we all understand right now that we don't have a supplemental budget like we did with the garment industry and the casino during their tax remittance to the central government. So I think the C in itself needs to have a date so we can actually project it in the budget submission that they get from their previous year's expenditures. I know that this is such a moving target because there's no guarantee that somebody's going to get sick this month or next month or even for the year, or there's going to be 100 or 1,000. So it's such a moving target. But at the very least, we should have something submitted pre-budget period for our consideration so that we can address that. We can base ourselves off those expenses, because they'll probably end up submitting an actual budget, just a chunk budget, not breaking down the report itself. And we'll be getting the report sometime after the budget, and where we're actually budgeting short or maybe over for that period of, just for comparison purposes.
Yeah, that's an excellent point.
And they've invested
Thank you.
into our doctors right now. We have specialists on island, so a lot of those costs would actually shrink. We have I believe a new cardiologist on island now, and a lot of our medical expenses go for doctors like that. And I know he or she's gonna be overwhelmed, but at the very least, we can have the numbers shrink when they ask for a budget. So I think with C, we need to have at least a month be pre-budget submission by the administration, because they will be submitting a budget in April as well, or March, right, to the administration. Well, they shouldn't be submitting to the administration because they're not a line item department or agency. They should be submitting directly to us. So at the very least, we should have something there that states that they have to submit it pre-budget so that we can prepare ourselves in the budget process.
I would agree. And seeing that we have our Ways and Means chairman here and our veteran of Ways and Means and budgeting also here, what month, what time frame would you recommend? April, June? We could insert that in the substitute right now.
If everything works well, right? I'm sorry, Chair. If everything works well, that we can address the budget even earlier than the actual September 30 deadline. Maybe we can get it by February or March. During the period that they'll be submitting a budget, maybe we should get that or during that same period. March, is it March, right? March or April.
Okay.
March will be good, I think.
March 1st.
Yeah.
Budget submission is April 1st.
Yes.
We have 30 days to review their request before.
Right. So annually submit to the governor and the legislature no later than March 1st, on or before March 1st of each fiscal year.
Yeah.
Okay, that would work. Does that work for you, colleagues?
Yeah.
Okay.
That's fine. Anything that we can, so at least we see their expenditures for that. And we all know that that's going to be also a difficult number to put a real bullseye on, no? Because there's going to be patients that are going to be getting medical treatment during that period, and they're not going to be, their total cost is not going to be included. But at the very least, we have something we can work on.
Yes, thank you for that recommendation. I have no objections to that at all. Any other comments or recommendations that you'd like to make, colleagues, for the substitute?
Well, not on the substitute, but since we're working on the budget, we should just include this specific section of CHCC under independent programs or corporations in the budget this year, so that we don't have the bonus issue.
All right,
So-
I would agree. But I actually would like to see it in this bill as well, since this would be an annual requirement. They did agree that there should be an annual reporting requirement, and it would be most beneficial to the legislature to get it before we act on the budget, right?
Sure. But just to start creating a business unit for it in this current fiscal year, because by the time this bill becomes law, we might actually have the budget out of our hands already.
Right. Thank you for that. Any other recommendations? Okay, there being none, may I have a motion? Or actually, before we, yes.
Just before we move on, I know that they can request or submit a request for a supplemental budget. I think we might have to include a language there upon availability of funds, because like I said, we don't have any other collections outside of the general fund collections until we have another industry that can create a supplemental budget for the CNMI. Then we can actually have this, because they can always come back and say, well, you guys underfunded us, and the over expense of the hospital is going to be shouldered by the central government. And that's, I think, one of the things we need to also consider, that anything we appropriate and they overexpend, it's either the central government takes care of those obligations or they inherit those obligations, because we don't want to put our hospital also in a situation where they cannot qualify for certain potential federal grants because of their financial situation. And this might be the reason their financial situations are crippled.
Yeah, I hear you, and I think that the current language actually already, well, one, requires CHCC to operate in a manner that is within the general fund appropriation, and then the next part of that is that if they do exhaust their appropriated funds before the end of the fiscal year, they have to make the request. But I think that they also tried to insert language that would have mandated future legislatures to approve the request, right? And that's not the language that we included here. But your point is well taken, Rep. And I think that I don't know, Council, if you wanted to jump in here, but I think that I think that concern is addressed in the current language.
Yeah, I think it's just too wordy. We don't need to put if in any fiscal year. We can just put, the health network program shall submit a request to the governor and the legislature for supplemental appropriations as needed. Just as needed is the only thing I would add and I would take out. Everything before that, so it'd be strike that. The healthcare network program shall submit. Shall submit as needed.
It's not the health network program submitting; it's the healthcare corporation
or whatever. So I can even stretch that out too.
That's where the concern really lies, is because CHCC is going to be the one requesting, and it might actually not be this program that's overspending.
But they're going to do that with common sense anyway.
CHCC shall submit a request to the governor and the legislature for supplemental appropriations as needed. Okay.
We don't need to make that law. They're going to do that unless they're not operating with common sense, right? So I mean,
I don't understand why you want to remove the reference to the health network program and what happens if they exhaust funds. Like that has been,
because there's no teeth already. Should we go on recess?
sure, we can go in a short recess.
Thank you.
We were at subsection G.
And we just took out the if any fiscal year, in any fiscal year, right?
Okay. So we are back from recess and still on, just to conclude our discussion of subsection G, we are just crossing out the in any fiscal year of that language since it is a bit superfluous. And retaining the rest of the language. So CHCC under subsection G would be required to operate the health network program in a manner that does not exceed the CNMI general fund appropriation. And then if they do end up exhausting appropriated funds prior to the end of the fiscal year, then they shall submit a request to the governor and the legislature for supplemental appropriations. And this was also language that was requested by CHC. Okay, I think that we have covered all of the proposed changes in the House substitute. If there are no other questions or comments. Oh, yes, sorry, thank you, Council. And if we could go back to subsection C. So we also agreed, colleagues, to insert a month on or before March 1st of each fiscal year. CHCC shall submit to the governor and the legislature their report of the health network program. So including their analysis of program data, covering expenditures and reasons for off-island services, and then recommendations for future funding, program improvements, or policy reform. And that, as our as Representative Attal pointed out, would be really helpful for the legislature to receive that report prior to the budget deliberations. Okay. Thank you for your comments. Thank you for this deliberation. At this time, may I request a motion to accept the House substitute with the changes that have been made today? Motion has been made and seconded. All in favor of accepting House Bill 2277, House Substitute 1, please say aye. All opposed, please say nay. The motion carries. And can I just get some clarification from Council? Do we now need a separate motion to approve the bill, the House substitute bill, and send it out for a committee report?
The motion was to accept the changes, right?
Accept the changes and then now, I think, move to like committee report.
Okay.
Usually you use that as one motion.
Sure. Okay. May I have a motion then at this time to approve House Bill 2277, House Substitute 1, and have the committee report drafted for this bill?
So moved.
Second.
Motion has been made and seconded. All in favor of the motion, please say aye. All opposed, please say nay. The motion carries, and I'd like to request the assistance of our legislative assistant and council in drafting the committee report to include all the most recent comments that have been received on this bill. Thank you, colleagues, and I think that we are now at the end of the markup portion of our agenda. Are there any announcements? I just have one, and that is I will plan to call for a committee meeting hopefully towards the end of next week, depending on the session schedule and any other activities happening in the legislature, but to address the remaining items on our agenda today. And I think that's it for my announcements. Anything under miscellaneous? Okay, there being none, may I have a motion to adjourn this meeting? Motion has been made and seconded. All in favor of adjourning this meeting, please say aye. All opposed, please say nay. This meeting is now adjourned, and it is, what time is it? 10:50 a.m. Thank you, colleagues. Have a